The first time that I heard of it, I had a couple colleagues at some meetings mentioned that they'd used the product, and it was probably a good year before I actually ever used the product. You know, you get happy with the product and you decide, you know, I don't want to change the way I'm doing things. And with the years, I've kind of gone through different products. But really, since I've switched to SonicFill, which I think has been over a year already, pretty much exclusively using the product. Well, certainly initially, you know, it seemed like when you go to do teeth bleaching for the first time. I remember being at the convention thinking, like, is this possible that this could really work? You know, all of a sudden you could lighten your teeth, and kind of felt the same way about SonicFill. It's like, can you really fill a restoration just, you know, using the SonicFill and, you know, one step on most restorations? And yeah, so I would say yes, it did exceed my expectations. It's been a really great addition to our restorative dentistry here. The ease of use and placing the material in the preparation, and much faster. Especially, it's nice for people that have problems, you know, opening or get a little fatigued. It's a very quick and easy way to fill, and no sacrifice of aesthetics. I have to say, once we started using SonicFill, we went 90% exclusive from the day one. It's been really one of the better products, I would say, used for the first time. That, you know, no learning curve. You know, getting past the fact that you know, place all the material, you know, quickly, with getting pretty much no voids, which was a big issue sometimes when you're using the packable or the flowable. You know, the instrument might stick a little, and, you know, you'll take an X-ray a year later, 6 months later, and you'll see a void when I wasn't using it. And, you know, I would say that's practically non-existent now. Certainly within a week of use, I mean, you know, doing, you know, 5-6 restorations even, you know, you start really, this stuff is working pretty good, pretty easy to use, and never look back. I found, even for especially like Class 5 restorations, I really like it for that, because those are areas that have been hard to fill in the past, in that the instrument might stick, you might not get good adaptation, and sometimes you'd get some that would debond because you probably wouldn't get a good you know, adaptation to the tooth, where I feel very confident using SonicFill with those restorations. A lot of people will say, oh, you know, it's a little more expensive because of the amount of, you know, material. You only have you use a little carpule for each patient. But overall, like most things, like you could talk about digital X-rays. Oh, is the cost expensive? Yeah, the initial outlay might be expensive, but if you amortize it over the amount of time you spend or save, I would say the cost would overall be less in terms of overall costs.